Hello, everyone. Welcome you all to We Talk Do You, a show by Puberty to Menopause, a public health awareness initiative by Human Biologicals Institute. Human Biologicals Institute is a division of Indian Immunologicals Limited (IIL), which was established by the National Dairy Development Board (NDDB) in the year 1982 as its unit, and later registered as a company in the year 1999. Human Biologicals Institute was established in the year 1998 when the Government of India requested IIL to produce a modern tissue culture anti rabies vaccine to phase out the unsafe nerve tissue vaccine. The first manufacturing facility of HPI was established at Ooty. The facility is one of its kind in India to have rolled out the first Vero cell culture rabies vaccine in the year 2000. Subsequently, HPI launched other vaccines, and currently we are the major player in human vaccines. We're leader in anti-rabies vaccine segment and present in around 60 countries. With three state-of-the-art manufacturing facilities at Ooty, Gachibowli, and Karkapatla, Human Biologicals Institute has forayed into the market of clinically proven wellness products and infertility range of hormones. Our vision is to shape the global healthcare by spearheading the One Health initiative. Our mission is to innovate, produce, and market quality healthcare products and services to improve and extend lives. We believe in providing affordable products with high quality through continuous technical innovations and improvements to meet our customers' need. As a market leader, we feel very proud to share about a green initiative. We have taken a significant step to reduce the plastic burden by 160 tons per annum by introducing eco-friendly pack of our flagship brands. As an organization, we take our corporate social responsibility very seriously. Either it's adoption of government schools where IIL is providing infrastructure and help in midday meal program, and in coordination with NDDB through our gift meal program, thousands of school going children are benefited. We have recently donated an oxygen generation plant to TIMS. For more information, you can also log on to www.indomin.com. We Talk to You is yet another uh, a step by Human Biologicals Institute through Puberty to Menopause to create awareness about women's health, where we bring leading experts of our country. So today's topic is another most important and not quite known to many women out there. Uterine fibroids, it's been reported that around 75% of women are at the risk of having uterine fibroids at some point in their life, and many of it goes undiagnosed. So, how serious are uterine fibroids, and are they really complicated? So, we have a very special guest with us today who would help us to understand more about this. Please welcome Dr. Devanshi Gupta, infertility specialist, Dioki Hospital from Lucknow. A very good afternoon, Dr. Devanshi. Thank you so much for joining us today.
Thank you, Payal, for calling me today.
Thank you so much. Dr. Devanshi, before we begin, I would like to request all our viewers who have joined us live today, if you feel this particular topic would be of interest and would help somebody know about this topic, please do share this video with them. And if you have any questions, please do put it in the comment section, or you can also message us. We will take all the questions by end of this discussion. Thank you. So, Dr. Devanshi, most welcome once again. And let us begin with our discussion for today with the first question. What exactly is uterine fibroids?
So, uterine fibroids, as we talk, these are benign tumors of the uterus. Benign in general public, we say that they do not multiply or they can cause any much harm. They are like benign tumors or arising from the uterus, and they are generally only single cells. They arise from the smooth muscle of the uterus. and they can be anywhere in the uterus, on top of the uterus, in the middle, that is myometrium of the uterus, or in the uterine cavity.
Okay.
So this is what we call any mass of the uterus. Myometrium is called fibroid.
So,
And
yeah, sorry.
depending upon where they are located, they cause different symptoms. That's all.
Okay. So now that you have said, depending upon its location, the symptom varies. So before we go to the symptoms and how a lady would know that she's suffering from something like this, what causes uterine fibroid?
Uterine fibroid, as you have already discussed in the introduction, 95% of our women are already prone for uterine. So, first thing is early age of menarche. As our society is developing, we are getting menarche at an early age. People are becoming having menarche. We say then the age when the girl attains her first menses. That is called age of menarche. So, early age of menarche is itself a predisposing factor, and then we delay our marriage. So basically, the work of uterus is to produce babies, and when the uterus is not getting the work, the uterine muscles will multiply, 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 and they'll form a fibroid. So
Okay.
late pregnancy and unexposed estrogen exposure plus obesity itself can cause a risk for fibroid.
Okay.
So those are the risk factors that if and even Asian origin itself is a risk factor for developing fibroids.
All right. So you spoke about symptoms. So what kind of symptoms does it cause?
See, you'll be surprised to know, Payal, that about 70% of the patients with fibroid are asymptomatic. Symptoms occur only in 30% of the women, and they'll be in the form of either the patient can have abnormal uterine bleeding, that is, or during the menses, patient can have excessive bleeding. Other than that, if it is like located outside the uterus, maybe if it is located outside uterus towards your bladder, then it can cause pressure symptoms on the bladder, like urge to do urine frequently
Okay.
and pain or pain while passing stools. If it is posteriorly located, so it can cause pain to pass stools. And plus, in reproductive age group of women, it can cause infertility also.
Okay.
And like if it is submucous means in the uterine cavity, so it can cause bleeding between the periods also. Like a lady has her periods on the day one, and then after 15 days she again starts getting the period. So this is like it can cause abnormal uterine bleeding, excessive uterine bleeding, then infertility, pain, and pressure symptoms. The symptoms are like
Okay. So I think that gives us a brief about our next question that we were about to ask you, talking about the complications of uterine fibroids. Now, uh, as you have mentioned, ma'am, that 75% usually go, they don't have any symptom; they're asymptomatic. So,
yes.
having said that, if something doesn't have a symptom, how would a lady know that, understanding that this uterine fibroid is so common in ladies, how would a lady know, and do you
See,
suggest
mostly
that?
it is diagnosed if a lady presents to us with pregnancy. If
Ah,
the fibroid is very small, it will be asymptomatic. But
okay.
as if fibroid starts growing and the size of the fibroid increases, it will cause some or the other symptom. And if it is asymptomatic, the common persons need not worry about it. Why? Because it is very least chance of malignancy. Only 0.3% to 0.7% of the cases of fibroid will ever convert into malignant. So it is not life risk, though life risk due to fibroids.
All right. So, talking about the complications, you mentioned about abnormal uterine bleeding, excessive uterine bleeding, pain, and difficulty in conceiving. So,
Yes.
apart from these, are there any more complications if the uterine fibroid and the growing fibroid is undiagnosed and it's ignored?
Complications are little more than this. These were basically symptoms. So
Okay.
complications is like if you have conceived with a pregnancy, fibroid with pregnancy. So fibroid can cause a lot of pain during pregnancy. That will become a complication, pain during pregnancy due to fibroid. Then
Hmm.
there can be recurrent pregnancy loss. If
Okay.
a lady is having pregnancy and she goes for abortion, this is also a complication of fibroid.
Okay.
Then excessive bleeding, which can lead to anemia and other causes like loss of blood, this is also a complication. So depending upon the size of the fibroid and at which stage it is causing the symptom, it will cause the complication.
All right, all right. So, thank you so much, Dr. Devanshi, for answering the questions. I would like to request our viewers who have joined us live today, please stay with us. We have more, insightful questions for Dr. Devanshi and a lot of discussions coming up. So you can have your questions also. We would love to take that band of this discussion. So, Dr. Devanshi, now what do you suggest the women watching you today? Would you urge them to take this seriously and make it a point at some point that they should be visiting their gynecologist and talk about this? If not, so what would be, according to you, how and when would be the right time to see a doctor? Let's say if they are facing certain symptoms. I think the basic one would be pain or irregular menstrual bleeding. So over to you, Dr. Devanshi.
They can visit if symptomatic. They have to visit. Do not delay your visit to doctors in case you are having any symptoms like pain in lower abdomen or excessive bleeding. Then you have to visit your doctor. And being an infertility practitioner, I do find fibroid more common in my practice. So if a woman is trying to conceive, then they should visit us. And for asymptomatic women, I would suggest at age of 30 to 35 years, there is a general full gynecological checkup, like screening for pap smear, cervical cancer, and all other things. So they should visit at least by the age of 35 if they are totally fine and asymptomatic. Otherwise, for infertility, yes. Excessive bleeding, yes. Any pain in lower abdomen, yes. Any symptoms, you should visit your doctor as the earliest. Get investigated. It is very easily diagnosed by an ultrasound, or even if it is a large fibroid, we can do it by manual examination. Also, we can diagnose it.
Okay.
So that's the case. So
Thank you.
timely consultation is more important.
Yes, absolutely. Absolutely. So, Dr. Devanshi, now, are there any ways and means that a lady can prevent this? Is it possible?
Prevention is healthy lifestyle, first thing. Then reducing the age of unopposed estrogen exposure. That is, if there's an early menarche, we should plan our marriage early and plan kids earlier. Do not delay till age of 35. In general, it has been studies have been there which suggest if the women have conceived at an earlier age, they generally don't tend to develop fibroid.
Okay.
And but it can be, it is not a like all or none phenomena. There's some genetic predispositions. If the fibroid runs in the family, she will develop.
Okay.
So, and plus, yes, one of the risk factor I already told you, obesity. So, healthy lifestyle, switching over to healthy food choices and keeping your weight under control is one of the important risk way to prevent it.
Great. Thank you so much, Dr. Devanshi, for answering all our questions. I'm sure the answers would really help a lot of women out there. And knowing something like uterine fibroid, which is not very, which is not talked quite often among
And one of
the
the
groups.
misconception the general public is that it is a tumor, so it will spread.
Absolutely.
It
Yes.
will not spread, but it will just affect your quality of life. Like if you are having heavy periods for a week or 10 days, then you are tend to become anemic and all those. So it will not spread. It is mostly benign, but get it treated in time.
Absolutely. I think the point that you have mentioned, that if you're 35 and even it's a very good point to have a regular visit to your gynecologist, take care of yourself, and have a regular checkup. I think that would really help a lot to keep it under check, and if at all somebody is suffering, it can be treated on time. Thank you so much, Dr. Devanshi. I think it's time for us to move to our next segment. If we'll see if you have got some questions from our live audience.
I'm sure.
Yes. Okay. So our first question is from Akshay. Ma'am, can family history of fibroids cause uterine fibroids? I think ma'am has already mentioned that, but over to you, Dr. Devanshi, if you would like to mention
Yes,
more about
it
this.
is seen. There are some genes, especially Alport syndromes and some other chromosomal genes, which cause increased tendency of developing fibroids if there is mother having fibroid, mother's mother having fibroid. So it do run in the family from the female partner.
Okay, all right. But the lifestyle, okay, but the lifestyle changes that you have mentioned can help it to keep under check, right?
Yes.
Great. Thank you so much, ma'am, and thank you, Akshay, for your question. So our next question is in our inbox. So we have got a question asking, okay, if how is the fibroids removed? Is the operation a major one?
Yes. Okay, depending upon the fibroid, where it is. So I already told you if the fibroid is in the cavity, that is inside the uterus, submucosal, hanging with a pedicle or something, we can do it hysteroscopic removal. That will be just like a little minor procedure. We put an endoscope and cut the fibroid and achieve the hemostasis and come out. So you need not get a cut anywhere on your abdomen for a submucosal fibroid, which is a pediculated one. Other than that, depending upon fibroid where it is, the subserous, that is the outside the uterus if you have a large fibroid. Outside uterus, those are also easy to remove. The difficult ones are either it is like posterior or cervical, which is very near to the rectum, or rectum means your bowels, okay, or very near to your bladder or something. They do tend to cause risk during the operation, and operation can be done by varied types. It can be open, it can be laparoscopic. There's a lot of advancement. Laparoscopic oscillation of fibroids are also done day in and day out. So yes, depending upon what is your fibroid, where it is located, what is its size, it can be a very complicated one or it can be a very easy one too. So
Thank
it
you.
is very
Great.
patient. And for us, every operation is very important.
Absolutely. Yes.
We cannot say
Thank you.
that
Thank
this
you.
is easy.
Absolutely. I think we are getting some more questions, Dr. Devanshi. One question from Mr. Asim: what's the role of nutritious food in avoiding fibroids?
No, I already told you that obese women are more prone to develop fibroids. That is because their fat cells, there is a enzyme which converts androgens to estrogen in the fat. So if your body fat is less, you will have less estrogen in your body, which will cause less fibroid to develop. So
Okay.
for any healthy diet, like role of good fruits, vegetables, all this will also work as an antioxidant as well as help you to keep your weight in proper limit. Like you keep your BMI in the normal range, then you are it's not because of nutrition. If you get a fibroid, it won't be because of nutrition. You can still get fibroid for other causes.
Okay. All right. Thank you. Thank you, Mr. Asim, for your question. Indrajit is trying to ask, ma'am, does fibroid lead to infertility?
Yes, it do lead to infertility. And again, my answer will be it depends upon the location where it is located. So, and if it is near the tubal origin, the tube, we have something called fallopian tubes arising from the ovaries. So, if the fibroid is near the tubes or something and it is causing the mechanical disturbance of the tubes to pick up the ovum from the ovaries, then that can cause infertility. Plus, if it is just submucosal, it can cause recurrent implantation failure, means your baby will not get implanted. They are picking up ovum, the baby is being formed in the tubes, and it cannot come and get implanted in the uterus because the uterine bed which receives the baby is hard due to fibroid. Plus, it can cause recurrent abortions. Like if there is a big fibroid due to pressure effect and due to all those effects, it can lead to abortion. So fibroid is a very tedious thing in infertility, and it definitely can cause infertility. And if it is more size, we operate fibroid for infertility reasons, even if it is asymptomatic. In
Oh,
general public, we operate on fibroid if it is symptomatic. But in infertility itself we consider as a symptom for fibroid operation.
okay, all right.
But only for large fibroids. It is like a two-sided sword. Like for very small fibroids, we tend not to operate. We ask the patient to conceive first. And if it is more than 5 centimeters or something, then we ask the patient to get operated first.
Great, great. Thank you so much, ma'am, for answering, and thank you, Dujit, for your questions. Do we have any more questions for today? Okay, I think that's all for now, Dr. Devanshi. So these were the questions that we have got for today. I'm sure I would request if anybody who will be watching this video in future, if you get any questions regarding this, you can still write to us on www.pubertytomenopause.com. You can subscribe there and you can send us your questions on mail. We'll ensure that you get the answer, the appropriate answer through mail. And till then, I request all of you to follow the page Puberty to Menopause. You can share this video of Dr. Devanshi to your friends, relatives. So, this topic, uterine fibroid, should be known to as many women as possible in India. So, Dr. Devanshi, I really thank you from the entire team for being with us today and having such an insightful discussion with us and answering all the questions. Thank you so much, Dr. Devanshi. So, before we wrap up, would you like to share something to our viewers?
Thank you so much, Payal. The only thing I would like to say is your fibroid is not going to turn into malignant, very less chances. But please do take care of yourself and get it checked and visit your doctor as you need it.
Thank you so much, Dr.
Fibroids are
Devanshi.
not dangerous.
Yeah, it is not dangerous provided you take care of yourself and have a regular consultation with your gynecologist. I think that would really help. Thank you so much. Till then, till we meet with our next We Talk Do You session, take care of yourself, and I wish you all have a great evening. Thank you so much, Dr. Devanshi.
Thank you so much.